As a province, we are concerned about the decline in terms of the number of people who are coming to be vaccinated. We think this probably is as a result of when they see the numbers going down, when they see the number of those who are being hospitalized going down, forgetting that most of the time when we have people admitted in the hospital, like today, we've got only 8 patients here in our biggest COVID-19 facility in the province. And this is as a result of those who have not been vaccinated. We still want to urge our people that the reason why the numbers are low, people are not getting sick, is because many people have been vaccinated. So if you are out there, you have not got the vaccine, you must know that your life is still at risk, your life is still in danger. We have come to a conclusion as a country that as compared to 2020, when we have got no idea on where to start as we were fighting this pandemic, because it was never there before. It was a novel virus that we're dealing with. Today in 2022, we're dealing with a virus that we understand how to defeat it, and we know that through our vaccine program, we can now begin to treat it like flu and treat it like normal. The schools must open, learners must go to school in full capacity, businesses must open, must thrive, the stadiums must open, people must attend weddings, people must attend their funerals. But what is important is that people must get vaccinated. And many people are asking, why are we getting boosters now? We're still reiterating our message. If you have received the vaccine and it's 180 days later or 6 months, you should get your booster, because the booster vaccine, the vaccines, firstly, vaccines have made it possible for us to open all these activities that I've spoken about. So when you get a booster, you are again at the same time continuously protecting your immune system. Hence, I've said earlier on, we are now dealing with this virus like we're dealing with any flu virus, which on an annual basis, every flu season, prior it, I personally get the flu vaccine. I've never said I'm not going to get it annually. I've always received my flu vaccine. So the same with the COVID-19 vaccine. We are still from time to time going to get the vaccine as it is for now. We have not yet developed a vaccine that will say you'll get the one shot, it's for your life or it's for 10 years, like we're doing. You see, with the tetanus toxoid, after 5 years, we can give you another a shot if you get injured. After when you've got a clean wound, but when you've got a dirty wound, 5 years, we give you another shot. When you've got a clean wound, 10 years, we give you another shot. But people have never questioned the nurses. Why are you giving me tetanus toxoid? Because I was vaccinated before. We still vaccinate you because we must make sure that those antibodies in your immune system continue to be there. So that is the reason why even now we're saying after 180 days, you must still get another booster so that you continuously boost your immune system, you continuously build your antibodies. And we've seen with COVID-19 that even if you are getting natural immunity, it's not for life. After sometimes it lapses, you get reinfected. So even with the same with the vaccine, until such time, if probably we can have a vaccine that takes us for a long time, but as it is for now, every 6 months, those who got their vaccine 6 months ago, go, please come and get the vaccines. You can argue, but the bottom line is that we have seen the vaccine saving lives. There are those who are still rejecting the vaccines. I can tell you, some of them are admitted in the ward. What is quite interesting, they are trusting the very same nurses to give them medication to treat COVID-19, but they don't trust the same nurses when they are giving them the vaccine. So guys, it's up to us. If you are a breadwinner and you are not vaccinated, I'm very worried about your commitment and the love that you have to your dependents, especially your children. They did not choose you, you chose to have them. So do it for them, not for yourself.
So MEC, where can people get their booster shots?
Booster shots, like any vaccines, whether it's Johnson & Johnson, because remember the booster shot for Johnson & Johnson is the second dose. The booster shot for the Pfizer is the third dose. Any facility, even if maybe your first or second dose, you got them in Cape Town, any facility in the province, anywhere in the country. If maybe we gave you your first dose when you were at home, If you want your booster dose, you are in Cape Town, you are in Free State, as long as it's in our country, we're using the same system as the EVDS. Anywhere where they provide vaccines, you can get it. Private sector, public sector, you can get your vaccine.